Back now on Try Today, and always glad we can spend a few minutes with some of the good folks from Northern Regional Hospital. And this time, we're going to focus on the nurse practitioners, and we happen to have two of them with us right now. And we welcome to the program Ashley Bryant and Samantha Kuntz, both, as I said, family nurse practitioners at Northern Family Medicine, part of the Northern Regional Hospital family. Good to see you, ladies.
Thanks for having us.
Ashley, let me start with you. You're both relatively new providers, although you've worked in the business in ICU and other things for many years. But as far as going into a private practice as a nurse practitioner, so let's learn something about you. Where were you born, and why did you decide to go into healthcare in general?
Okay, born and raised in Mount Airy, North Carolina. So lived there my entire life. My grandmother was a nurse. My mother works in the laboratory. So healthcare was kind of all that I knew growing up.
They were your role models,
so
right?
Absolutely. From a young age, I knew that I wanted to go into nursing.
Right. Now, what is your role? And I'll ask Samantha the same thing. But what kind of role do you play as a nurse practitioner in a practice like Northern Family Medicine?
So patients come in. I act as their primary provider. See anyone from sick visits to managing chronic illnesses. We do small procedures in the office. So we do injections, joint injections, replace IV fluids.
Doing a lot of things that people used to, when people in the old days, and I say that because I'm 100 years old, but you go in and it had to be a doctor.
Right.
And now you guys open up a whole...
So we're advanced practice practitioners, providers. So we do essentially the same things as physicians do. So we're able to diagnose and treat, prescribe medications, order testing.
Yeah, Samantha, you're nodding,
Yes.
in agreement. You really like this stuff, don't you?
I do. I love it. Yes.
Making the transition from, like, the two of you working in ICU, which is a very special thing, and God love you, but now in a different role. Why do you like that too? I mean, in working with people.
I love it. I mean, I started out in ICU at Northern Regional Hospital. I was there for 8 years in critical care. I realized that I love taking care of people, but I wanted to be on the other side of things. So I went back to school and now focusing more on preventative care.
Yeah, prevention and treatment, that kind of thing. So let me back up and circle around to another question I had asked Ashley, but do it for you. Where were you born, and why did you decide you wanted to get into the healthcare field in general?
So I was born in Surry County, Mount Airy, born and raised there. I did not know that I wanted to be a nurse, so that is different from Ashley. I went to Lenoir-Rhyne University, initially majoring in biology. And I had several friends that transitioned into the nursing program there, and they kind of persuaded me. So, and I'm so glad that they did. So, started there, and then went back to school and got my master's at Western Carolina University.
Right. And now Ashley's your role model, is that right? No,
absolutely.
Yeah. Hey, Ashley, I want both of you to give us a couple of health tips. Let's start with you, Ashley, on why it's important to control your blood pressure, whether it has to do with diabetes, cholesterol, whatever. Why are those things important?
Okay. So controlling the blood pressure is important because over time, high blood pressure is going to affect all the vessels, vasculature in the body. So this could lead to heart damage, kidney damage. When you talk about diabetes, you have damage with the vasculature in your legs. People deal with neuropathy, eye damage, and things like that. So over time, you want to keep that blood pressure controlled so that you don't have things like heart attack and stroke and heart failure.
Absolutely, and that's why you always go in the doctor's office, they give you blood pressure. We have a few seconds left. Now, it's kind of a similar question. Why is it important for people to come in for an annual wellness check?
Annual wellness exams are very important. It's a time that we can focus on preventative care with our patients. We can go over vital signs with them, make sure their heart rate, blood pressure is in check. We can order routine labs, depending on their age, assess risk factors, and order appropriate screenings such as mammograms, colonoscopies, make sure they've had their pap smears.
Yeah, y'all are just full service, and you do such a great job of helping people. I'm just very proud of both of you for what you've done. Up on screen, don't want to forget to mention ChooseNorthern.org is the general website for the hospital that you can check out. It'll send you to all different portals to learn about these things. Will the two of you come back? We can talk about more things sometime.
Absolutely.
All right.
Thank you for having us.
We'll be right back after this.